Approach to chest X-ray. This is a PA view chest X-ray where the X-ray is passed posteriorly and the film is taken anteriorly. This is the spinous process in the midline between the medial end of the two clavicles, suggesting the patient is standing straight. This is the vertebral body which is visible behind the heart, suggesting the adequate exposure and penetration. This is the diaphragm between the 5th and 7th anterior ribs, suggesting adequate inspiration. Now coming to the features of this chest X-ray. This black matter is air-filled lungs showing radiolucency, whereas this remaining white matter is bones, soft tissues, vessels, lymph nodes, organs showing radio opacity. This radio opaque bone is clavicle. It articulates in the midline forming the sternoclavicular joint and laterally forming the acromioclavicular joint. This is the head of the humerus articulating with the glenoid labrum. These are the anterior ribs and posterior ribs forming the rib cage. There are 12 pairs of ribs. This is the diaphragm. It separates the thorax from the abdomen. It is innervated by the phrenic nerve, root valley of C3, C4 and C5. These are the heart borders. The right heart border is formed by the superior vena cava and the right atrium, whereas the left heart border is formed by the aortic knuckle, pulmonary artery and the left ventricle, whereas the base of the heart is formed by the right ventricle. Now coming to the ABC of the chest X-ray. First we will check the position of the trachea and bronchi. If it is deviated to the right side, it suggests right-sided fibrosis or right-sided lung collapse. Or in the left side, there may be left-sided pleural effusion, left-sided pneumothorax, hydropneumothorax or tension pneumothorax. Then we move to the structures involved in the breathing, that are lungs and pleura. We will divide the right lung into right upper lobe, right middle lobe and right lower lobe. Here we are looking for any increase in the consolidation or any increase in the opacification seen in infection, pneumonia or any mass or any abscess, or there may be signs of any calcification or any absence of the lung markings seen in pneumothorax. Now coming to the appearance of the heart. Here we are looking for any apparent cardiomegaly using the cardiothoracic ratio, which is the ratio of the width of the heart to the width of the thorax, which is normally less than 50%. If it is greater than 50%, it suggests cardiomegaly or any congenital heart disease. Now looking at the shape of the diaphragm, it is flattened in COPD with hyperinflation of the lungs due to increase in the air trapping. This is the cardiophrenic angle and this is the costocardiac angle. Here any blunting of angle suggests pleural effusion. Checking for any presence of the air under the diaphragm, it suggests pneumoperitoneum due to perforation. At last, we are looking for any fractures of the ribs. Here the clavicle is usually fractured in a middle 1/3 in a road traffic accident, and the ribs are also fractured in the middle 1/3. If the fracture is involving more than 3 consecutive ribs in at least 2 different places, it suggests flailed chest due to paradoxical movement of the chest. And we are also looking for any soft tissue changes or any subcutaneous emphysema, or also any foreign bodies suggesting like pacemakers or any implant.